The problem with heart attacks is most patients don't recognize the symptoms early enough and they delay going to the emergency room. And this is quite dangerous because when you ignore a symptom of chest pain or shortness of breath, you allow the heart attack to progress to a point where the heart muscle will be very hard to salvage.
Nung naglalakad kami, nakaramdam ako ng parang nahirapan ako huminga. Tapos sinabi ko sa anak ko, dalhin mo nga ako sa medical city kung kaya ko pa. After ng ECG ko noon, mukhang may heart problem. Kinausap nila yung wife ko, nilipat nga raw ako sa cardiac emergency room kasi main artery mo is may nakablock.
There are two main types of heart attacks. The first one is we call STEMI or ST elevation myocardial infarction. The second type is what we call non-ST elevation myocardial infarction. Both are very important clinical diseases, but the most time-dependent disease condition is what we call STEMI. And in this condition, the ECG shows a pattern which tells us that the artery is completely blocked and that we need to open that artery within 1 hour so that the muscle will not die and become scarred in the future. The golden hour is the 60-minute window which represents the emergency angioplasty time from when the patient arrives at the ER up to the time when we open up the artery. And this time is very important to us because this goal is correlated to patient survival. If you open up the artery within the hour, chances are the patient will survive the heart attack. The AMI program of the Medical City was recently recognized by JCI, an accrediting body which gives recognition to programs that are providing international standards of care. The certification of the AMI program in 2021 is very important to us because we have proved that we can still operate an AMI program in the midst of a raging pandemic. The healthcare providers can safely perform their work and still try to achieve the outcomes that we initially tried to achieve even before the pandemic, which is patient survival from heart attack.
Pag-visit nila doon sa room, nagulat sila na pagkatapos ng procedure, gumaan agad ang pakiramdam ko.
The primary goal of the AMI program is to improve survival from heart attack. Since the program started, we have maintained a high survivability percentage for all our patients who were enrolled into the program. So if you have a heart attack, this could be very devastating to a patient. The patient might not know how to go about this stressful situation, and the patient would need encouragement, education, and close monitoring for the patient to come back to his old self. It just shows that you don't just do angioplasty to heart attack patients. You need a team of experts, a team of doctors, and a team of specialties holistically giving care for the patient so that the patient can have a meaningful life after a heart attack. We are able to bring you back to your old self so you become a productive person in society, and so you are not encumbered by health issues and you are able to enjoy the quality of life for the rest of your life.